And welcome back to the show. Healthfirst recently had its first, its Health and Wellness Expo in the Bronx for the first time since 2019. And this empowering event actually focused on shaping a brighter future for Black and Brown women's health, discussing racial and female health disparities and maternal health, as well as much more. Joining us now to share of state programs at Healthfirst, Errol Pierre, and then the CEO of DetoxNow.com, Coach Gessie Thompson. And we thank you so much for being with us.
Thank you for having us.
Yes, absolutely.
I'll start first with you, Errol. When we talk about health disparities, obviously in the African-American community, and we know that in communities of color, there always seems to be this lagging number when it comes to how we measure up against others in the area of health. I know it's a topic of discussion that you're not just talking about, but that you're handling head on.
Absolutely, yes. So a lot of the reasons why we see some of these unequal health outcomes has a lot to do with our surrounding areas. So while 20% of someone's health outcome has to do with their access to a doctor, their access to a hospital, their insurance, 80% of the reason why they're either healthy or not has to do with extemporaneous things like where you live, your access to healthy foods, if your environment is safe, is there a place where you can playgrounds where you can work out. And so what we're trying to do is remove those barriers that stop someone from being healthy. And so this expo exactly did that. We brought healthcare to the members. We brought screenings, we brought information, we brought it to the community so that they didn't have to search for it.
Yeah. And so, Coach Gessie, talk to me a little bit about the work that you do. I know that you're empowering and the work that is going forward in helping people change.
Thank you so much, Daren. And you know, when you talk about these social determinants of health that Errol was referring to, the key thing is putting the hands in the power of the people, right? You've got to put the power back into their hands. And that comes with the advocacy, that comes with the education. So for us, you know, at the Detox Now, we've partnered with Healthfirst because we see them on this mission to really actually not just, like he said, provide healthcare services, but actually wrap the community, wrap the people around with all of the other pieces, the access, the support, whether it's education around, you know, for us, it's about teaching people what foods actually they can eat to help improve their health outcomes, using food as their medicine, to helping them learn how to advocate for themselves when they do go to the doctor and ensure that they have proper health care. One of our partners actually is Earth app. And what they do is they have a Yelp-like review that provides ratings and reviews of healthcare providers, hospitals, pediatricians, because when we look at the Black maternal health crisis, we, again, putting the hands back in the power in the hands of the people, we want them to know you can actually provide reviews and information on the care that you've received, and also look for services of people who are going to provide care in a way that you are valued and can have positive health outcomes. So yes, we are trying to change things on the outside, but we want to make sure we use the power that's in our hands by lifting our voices and using all the resources available to us.
Can you share with us a little bit more in the area of postpartum depression? I know that's something that a lot of women of color really deal with. Sometimes it's not always talked about, but it's a very real issue that's being tackled and being dealt with.
You know, that hits home for me because I personally battled fibroids for 14 years and infertility caused by those fibroids for 10 years. And as you can imagine, a 10-year journey to have one miracle baby. I actually did suffer from postpartum after that, and not really knowing that's what I was going through. I'm so excited that what we're doing is providing access to doulas and care workers who will actually name these things, as well as, of course, mental health care practitioners who will name these things and help women to feel the support that they need and access to the help that they need. Because, you know, like for instance, the fact that healthcare is being provided outside of, not just after birth, for a year after birth, right, as part of the overall way to end this, to reduce the Black maternal health crisis. That's because if they don't have support after the birth, that is where a lot of women are lost. So that's a really important thing that they're providing.
Yeah. I want to talk, Errol, if you could share with me about COVID-19. It had a huge impact in the African-American community. Talk to us about how you see it playing out from your lens.
Absolutely. We quickly saw the disproportionate impact of COVID on communities of color. So places like Elmhurst, Queens, places like the Bronx had exacerbating rates of one, COVID positive rates, and then two, an inability to get vaccinations. And so we were, and also disinformation. People were unsure about what vaccination to choose. So we were front and center in making sure that we would help people book an appointment. We had a phone line, people could call us. We would be the ones doing all the work to get their information, get them an appointment, and then share with them where to go. We actually had over 400 volunteers from Healthfirst that volunteered at vaccination sites because everyone needed a hand on how to get all these long lines shorter and helping seniors get vaccinated. We were proud to even send people to people's homes to get vaccinated. We did educational campaigns to make people aware of the vaccinations, what's in it, and dispel any rumors or myths that it wasn't safe. It was a ton of work that we did in the community with our partners to make sure that the education was there. Now, once you're vaccinated, that's the one piece. The other piece is you have to continue to make sure that you're healthy and you make sure that you take advantage of preventive care medicine. Because what we saw is people who had high rates of hypertension, diabetes, obesity, also had worse outcomes if they did get COVID. So just getting vaccinated is one tool in the toolbox to remaining healthy. The other tool is making sure that you're eating healthy, you're exercising, and you're keeping yourself healthy and your family as well. Now we're just looking towards the impacts of what we call long COVID. And so these were people that potentially had COVID and they're still feeling symptoms. They still feel shortness of breath. They still don't feel like they were pre-pandemic. And we want them to get back to care. We want them to feel safe to book appointments so that we can make sure that we can manage those chronic conditions now over the long term.
You guys have just had success with a recent event, but talk to me about your hope, your takeaway in the event and what you wanted people to walk away with.
Sure. So for me, we, like Coach Gessie said, we want to empower the consumer and put education in their hands so they can make the right decisions. My hope, she mentioned postpartum depression. We piloted a program with Mount Sinai where we actually put caretakers in the homes of pregnant women. And we actually saw postpartum visits for Black and brown women be at the same rates as white women, which was an awesome study that we did a few years ago before pandemic, and we want to continue that. The other thing we want to do is make sure that people have their rights, they have choices. There's this concept called ethnic concordance, which means you can find a provider that looks like you, speaks like you, understands where you're from. We're doing a lot of education to encourage our members to find those types of doctors. We are doing our best effort to make sure we contract with those doctors so that those choices are there. And so it's really post-COVID, getting back to healthcare and really thinking about yourself and taking an empowered approach.
Yeah. Coach Gessie, we'll leave you with the final word as to what you want people to know going forward.
Well, I want people to know that they're not alone, right? That's why we came into the community, but we weren't just there for a moment, right? Whether it's, accessing resources through our websites at thedetoxnow.com or Healthfirst to get free food lists, to get access to all of the services that we have available for you. What we want you to know is that you have a tribe, that your future can be bright, and we're not here for the moment, we're here for the marathon.
Coach Gessie, Errol, we want to thank you so much for being with us. Great information being shared. Of course, we will pass the information on. Our viewers had a chance to look at the lower thirds on the screen to be able to know the websites to be connected to, and hopefully somebody will take advantage of taking advantage, I should say, of the services that you guys provide. Thank you so much for being with us.
Thank you.
Thank you for having us.